Thank you for the opportunity to discuss these important matters in front of this committee. I appreciate the chance. This is an unnecessary taking of money from people who are caring for our sick and disabled family members just to give it to a union. Why? This isn't collective bargaining. The care recipient is the person that hires and fires the care provider. The state and federal government provides the money. The Michigan Department of Health and Human Services handles the tax withholdings. There is nothing here that a fake employer can do except masquerade as a collective bargaining foil. This isn't the UAW and Ford. This is lobbying, pure and simple. The Home Health Caregiver Council is a useless sham. Since mandatory unionization ended in 2013, the program has doubled in funding, from around $300 million to around $600 million over this last decade. You, the legislature, decide the funding levels and the pay rates. If you feel that these people are underpaid, you can fix that right now without a union. So what is the benefit of giving the union a 2.75% cut of $600 million? For the union, that's up to $16.3 million a year bounty. We are going to force caregivers to take time away from their loved ones to attend a mandatory training on important yet fairly simple tasks like bathing, feeding, and toiletry. Everyday tasks they already know how to do. They'll also be forced to sit through a half-hour unionization drive, a special privilege given to no other lobbying group. The SEIU will be able to use this time to pressure individuals into joining the union. And once in the union, similar schemes in other states show that the SEIU will do everything it can to keep people from getting out. Aside of being bad policy, it's unconstitutional. This body cannot make private citizens public employees, just as anyone who receives Medicare or Medicaid and the doctors who provide them care are not public employees. And even if we were to accept the fiction that they are, they would be under the Michigan Civil Service Commission, not Merck, as these bills presume. These two bills would take necessary resources from our most vulnerable citizens and their family members and divert a windfall to the SEIU for the union to use as it sees fit, including spending on partisan politics. This is atrocious public policy, and you should reject it. I thank you for the opportunity to testify, and I'm happy to answer any questions you might have.
Are there any questions? Okay, seeing no questions. All right then. Representative Weiss.
Thank you. So just a question. You gave some data about investments over the past decade. Can you speak to what have wages been over the past decade? Have they gone up? Have they gone down? Have they been stagnant? How has that worked out for home health care workers in the state?
They've gone up. The number, I believe, in 2013 was around $690 or something along those lines, and it's now 13 and change. 13 and a quarter, I believe, is what the wages are now.
So we're still not above $14 an hour?
Not to my knowledge. I believe the last figure I saw was for $13.25 was the last hourly rate.
What about any benefits or anything?
There are no benefits. Again, this is a means test program. You all can, as you're the legislature, if you want to say that you would like to provide benefits for 35,000 people, you may certainly do that without a union. You have provided them funding increases pretty much from 2013 on, and you currently have that power. So the question is, what is the unionization adding? And the answer is nothing except an opportunity to divert money to a different place. All of this stuff is in your power. Any collective bargaining agreement, and I'm using that term in scare quotes, doesn't really exist. It's a joint lobbying statement between the union and this so-called employer that they would bring to you, the legislature. And you would have the opportunity to say, we want to give these people more money, or we do not. And that would be in the vote that you make the same way you make it every year in the general omnibus bill for budgeting.
Thank you.
Thank you.
We have one more question. Representative Steele.
Thank you. Just maybe you might be able to answer the question that Representative Leitner asked earlier.
Oh, I'm sorry, Representative, I couldn't see it.
Oh, it's, it was just the cost of the whole entire, if you have a rough estimate of this. Just
Sure.
'cause I would
For
like-
the 24-25 year, you all have budgeted $593,454,500. That is from 2024 Public Act 121 at page 129. That does not include the $1 million implementation fund and another $9 million on top of that for this fake employer to operate for the next 10 years.
So $520 million a year roughly.
593.
Thank you.
Thank you for your time.
Sure, there are no further questions. That appears it for testimony.